Hi, Dr. Gullberg here, continuing our internal medicine series of lectures. Today we're going to talk about lactic acid and lactic acidosis. Some confusion out there about this test. We're most commonly using it at the hospital for monitoring our septic shock patients, but I think we should talk a little more about it. So normal levels of serum lactate are between 2 and 2.5. High levels are more than 4, certainly. So lactate is produced in most tissues, with muscle being the main source in the body. It's produced under anaerobic conditions and gluconeogenesis. Under normal conditions, lactate is typically cleared by the liver and a small amount by the kidneys. So when the serum lactate level is elevated, there's two types. There's type A and type B. Type A is due to states of tissue hypoxia or hypoperfusion. So we're going to see this in shock, especially septic shock, cardiogenic shock, hemorrhagic shock, any place where there's regional ischemia, compartment syndrome, gangrene, Fournier's gangrene. Elevated levels are certainly associated with mortality. On the other hand, type B type of lactic acidosis is due to about 12 different things. I just want to review those with you so you're aware that many types of medical problems can cause lactic acidosis. Number one, seizures can cause transient elevations. Number two, excessive muscle use. So people who are marathon runners, people who are having asthmatic exacerbations, increasing their work of breathing, that certainly can be associated with lactic acidosis. Pancreatitis, subacute bacterial peritonitis, burns, smoke inhalation due to cyanide or carbon monoxide inhalation, diabetic ketoacidosis, obviously, thiamine deficiency due to poor nutrition, especially found in alcoholics, hyperemesis gravidarum in our pregnant females, or anorexia nervosis, or even in patients with gastric bypass surgery. Certain cancers can cause lactic acidosis, especially lymphomas or leukemias, if there's mets to the liver. Finally, never forget about drugs. So certain drugs are associated with lactic acidosis. These include metformin, acetaminophen, linezolid or Zyvox, beta-2 agonists, and epinephrine, likely due to beta-2 stimulation. Cocaine, theophylline, propofol, and certain meds used for HIV infection. So large potpourri of causes of lactic acidosis, but I think it's important to kind of know the differential diagnosis of that. Thanks a lot. Dr. Gullberg signing off.